Good afternoon, everyone. First, I would like to say thank you to all of you for attending. I'm very excited to share this information with you, as I hope you are just as excited to learn and receive the information. As you all know, we work in the healthcare industry, and there is a growing number of changes happening on a day-to-day basis, and some of them can be hard to keep up with. Today, I would like to go over a few of those with you. The healthcare system as a whole is working towards a total recalibration. Current business models are being challenged in order to find and deliver more new sources of value and also develop a more innovative approach to make healthcare less complicated. With this, healthcare is working towards value and not so much volume. This is going to have a huge impact on how the patients are cared for and how physicians and hospitals are paid. This has a lot to do with how many of our normal day-to-day charting has been changing, as well as many other things that are going to be implemented into our day-to-day charting and so forth. One of the bigger shifts in healthcare is that the market dynamic is turning more towards the consumer. What this means is that there is more of a financial risk in paying for healthcare that migrates from the payer to the individual. Providers are also now sharing the risk when individuals cannot pay. As a consumer, this means that there's going to be more of an increased obligation to pay a greater share of the rising premiums, the higher deductibles, the higher copays, as well as a higher percentage of coinsurance. Therefore, I think it would be wise of us as an office to start providing billing codes to our patients so they have the ability to call their insurance company and figure out what type of out-of-pocket they're going to be looking at before they even come into the office for the service. As an office, I feel it is important for all of our staff to be educated on what these changes in insurance mean as well. They need to know how to help our patients understand what these changes mean, as well as I want to provide a more of an individualized training for these employees so that they have the ability to better explain these situations to the patients. Consumers are bearing a more significant share of the healthcare costs today. They are being drawn into the healthcare system shift towards value. Healthcare expenses absorb a considerable portion of the household income, and as consumers are going to pick up more on the healthcare cost, they are also going to seek more like low alternative and better value service from the physicians. Not that it should be any different, but we need to be there for our patients and be understanding of these changes that are happening in the healthcare industry, as it can be very overwhelming to patients who have no idea what any of these things even mean. With that, consumers are also asked to take on more of the healthcare cost burden. They are also being shown new choices and options. Consumers' expectations of better services and better experiences are rising as they interact with the healthcare system. There are already more choices and services, more choices of services, products, devices, and other providers that consumers are willing to try all options. The service experience is becoming so important for the consumers as they are seeking more meaningful involvement in medical evidence and the decision making with their care. I don't know if many of you are aware of this, but many facilities are now offering a virtual experience where you are able to speak with a doctor via an electronic interface. This is something that I think our office would benefit from, and I would like to also eventually integrate into our office. We specialize in sometimes what can be a life-threatening situation, and if we have the ability to see the patient without having them come to the office, we can advise them on the best option of care for them, whether it be go directly to the hospital or come into our office to receive the treatment. Many of our patients work during the day and are not able to make it into the office to see if their problem is serious or not. Now we would be able to treat them. Some other benefits of this type of care, as I stated, a virtual doctor visit can be both convenient for the patient and for the doctor. Having a virtual waiting room is better than a physical one if the patient even has to have a wait. There is a possibility of an increased patient engagement due to a screen sharing capability. A more convenient automatic record keeping, as the doctor is able to have the patient's chart pulled up right there on the screen and enter anything that needs to be entered in the patient's chart right while he's speaking with the patient. It has also been proven that patients feel that the doctor pays better attention to them during these virtual visits. A survey was done of about 250 of our patients, and over half of them were willing to do a video visit with a doctor instead of coming into the office. I'm sure many of you are going to have a lot of questions and concerns about the changes that are happening and the things that are going to be slowly integrated into our practice. I would normally do question and answer session, but I want all of you to take a couple days and really absorb what I have shared with you today and send me those questions in an email. That way I can respond to each person individually, and then if needed, we can all meet again and discuss the questions and concerns, and then how this process will also be implemented into our office. I would like to also again thank you for your time today and have a great day.